Hi, everybody. Thanks for joining us today on Winsight Live. This will be our last episode of what's been a long and crazy year in the food economy. Before I kick it over to Phil, I just want to say thank you to everybody for tuning in. Thanks to Phil. Thanks to Tony behind the scenes, who's done a really great job with this all year long. And I hope everybody has a fun and relaxing and hopefully safe holiday season, Phil.
I agree, John. It's been one of those years, but we sort of have some good and some bad news. We now have the new $900 billion COVID-19 relief package, $284 billion in PPP loans. And I just want to read some highlights of what's in this that passed yesterday. Federal eviction moratorium extended through January 31st, $28 billion dedicated to the distribution of the two FDA-approved COVID-19 vaccines. $13 billion to SNAP benefits, $45 billion to transportation, $82 billion to education, $10 billion to child care assistance, $15 billion to entertainment venues and movie theaters, and $7 billion for an increase in broadband access. Notable what's missing here is the Restaurants Act would have established a $120 million revitalization fund specifically to provide relief for food service and drinking establishments, was not included. What's going on here? I mean, you could open up a movie theater and you can get money for a movie theater, but you can't for, what's one of our biggest industries in this country, restaurants.
Well, the restaurant industry is hoping that come January, they will look at it again and come back with more funds. So this is kind of a stopgap measure. At least they'll be able to make it through, into January. But
just think of all the restaurants that they don't have. First of all, that they can't operate. That they don't have the Christmas party revenue. They don't have New Year's revenue. I just think it's absurd for what's not included. And, John, what else isn't included?
Well, according to a report from our colleague Christina Peters, the bipartisan COVID relief bill includes direct payments and jobless aid to Americans, as you mentioned, Phil. What it doesn't include is liability protection for grocery stores and other businesses to protect themselves from liability lawsuits stemming from their efforts to, safeguard employees and guests from the COVID-19 virus. So that was something that the NGA and FMI had argued hard for in the weeks leading up to this. And apparently it was part of the bill that was included in a proposal as late as last week.
But, when we look at liability protection, certainly we don't want the industry to have lawsuits, but there are certain parts of the industry that have been remiss.
Traded out.
That have been remiss during COVID-19. And, I think we should have the Restaurants Act as part of it. And I agree not having the liability part. So Jackson, how are C-stores getting involved in the COVID-19 vaccinations?
Well, and another example of things that would have been nice to have 8 or 9 months ago, but I suppose we'll take now. GoPuff, which is known in CSP as sort of a C-store without a store, a big competitor for C-stores in urban markets. They are the first company to deliver instant COVID-19 testing kits. They've partnered with Pure Lab for this. This is a saliva-based test that you can have delivered to your house in about 30 minutes or less, or depending on the traffic on GoPuff that day. So because it's saliva-based, you don't have to stick a big swab up your nose, which is great. It is on the expensive side. It is $129 for this test. However, insurance does cover the test, depending on your insurance, of course. So, if you're a family and you're not sure if you should, go to your grandparents for the holidays, if you might be a carrier of COVID, you could get this test real quick and see if you should avoid that or not. Of course, all of the all the regular warnings still go with that. There is room for error with these tests, but it's certainly a huge help to have these tests available in 30 minutes or less delivered to your door.
And is it as accurate?
I can't speak to the accuracy of it. I would assume that because I would assume you're sacrificing a little bit of accuracy for the comfort of not having to poke your brain.
Right.
But I don't have anything for sure certain on that.
So, Christine, it looks like everything we're going to talk about today is COVID-19, back to our roots. What's going on with grocery workers?
Sure, it's been a pretty busy weekend in terms of COVID-19 talks and relief. Besides the relief bill yesterday, over the weekend there was an emergency meeting of a special advisory committee to the CDC. They did a couple things there. Number one, on Saturday they formally endorsed the Moderna vaccine for emergency use, following the FDA doing the same on Friday. On Sunday, they looked at the CDC's recommendations for who should be next in line to get coronavirus vaccines. And they determined this expert panel, it's made up of people in, physicians, nurses, public health officials from across the country. They voted to endorse the CDC's recommendation that frontline essential workers, as well as individuals over the age of 75, be next in line. So after healthcare workers, after residents and personnel at long-term care facilities, frontline essential workers would be next. They're the phase 1B group. And that's an important distinction because they also considered a phase 1C group. So frontline essential workers includes grocery workers. Grocery workers would be next, along with manufacturing workers, teachers, first responders, firefighters, police officers, corrections officers. The phase 1C group includes food service workers, and some other groups, individuals who have pre-existing conditions that would put them at higher risk of severe illness or death from COVID-19. So after voting to endorse these, that recommendation goes to the CDC director, Dr. Robert Redfield, and he typically will say, okay, good with these recommendations, and then they'll go out to the states. Ultimately, the states, of course, are the ones in charge of making final recommendations within their state borders of who's going to be next in line. So grocery workers, different associations, state grocery associations, as well as industry trade groups such as National Cattlemen's Beef Council, as well as National Cattlemen's Beef Association, National Pork Producers Council, have been saying, we got to get this out to our people next. Some of these groups are also saying, hey, look at all the protocols that we've, put in place. We've got a lot of people working at our facilities. We have the infrastructure to support distributing the vaccine at our locations. Let us be next in line to do that. So that's where we're going to be rolling out next.
So, you mentioned state associations. What is the CEO of CGA saying?
Sure. I had a great chance to talk with the CEO of the California Grocers Association, Ronald Fong. He's served in that role since 2008. And we had a really interesting discussion about a wide range of topics. But one of the things that he talked about, in advocating for priority access for COVID-19 vaccines for workers, is how that's going to work, actually. It's one thing to say, hey, we've got people on the front lines. They've been out for 8-9 months, taking care of people, letting essential services run, letting people get their groceries. These people need to be protected. It's another to step back and say, okay, we have access now. How are we going to do it? And he said he's been appointed just last week to this this group in California that the governor has created a task force on vaccine distribution. And they're going to be looking at, how do we manage this? How do we actually make it work? Within a grocery store, who's first in line? Which groups of people need to get access first? That's going to be a lot of discussion, he said, over the coming 3 weeks about how to make it work. But, everything's in, thank goodness, everything's in gear. The ball's rolling.
And Pat, outdoor restaurants, there's like some anger happening here.
Well, especially in California, because California actually has the type of weather where you can eat outdoors now, and the governor shut down outdoor dining. And restaurateurs there are just like up in arms because they see movie companies, actually, dining outdoors under tents with their crews, and in the, right next door, a restaurant is not allowed to have their patio open. So we've interviewed like a couple of professors of chemistry to find out what the real risks are of eating outdoors. And two of them said there really isn't any risk as long as you're 6 feet apart and you follow the safety protocols. You wear your mask when you're not eating or drinking. And if you're not sitting downwind from somebody, even if they cough, you won't get infected. But those structures like the igloos and the tents can be just as bad as dining indoors. And, they have to be more open. They have to have some kind of ventilation. One of the professors actually sort of compared it to smoking. If you can smell someone smoking outside next to you, then you can probably be, infected with their virus if they have one.
So, in all fairness to California, living here, there are a lot of restaurants that are cheating. We're cheating. That you didn't have 6 foot of distance between the people that were eating outside. And what's happened, at least here in Santa Monica, they've moved out into the street. They've built these structures, some of which do have like tent tops to the top of them. They do have open sides. But in the beginning of this, there was actually inspectors walking around with tape measures to make sure that it was 6 feet apart. But I haven't seen those for months, those inspectors, and I can think of probably 4 restaurants that it's not 6 foot apart.
Yeah, I think people have gotten a little lax as the pandemic has wore on, but these two professors of chemistry believe that you really need to keep that distance and make sure that the outdoor structures are open on at least 2 sides and have a lot of ventilation. And there are actually ways to measure the CO2 emissions. There's a simple meter that they can install if people, would want to invest in that. That would be a real security measure.
The other problem that I'm seeing is they still allow takeout.
Mhm.
So what's happened, especially in Venice, California, people go get takeout and then they're standing out in front of the restaurant in a group without masks, all eating together, and probably within a foot of each other.
Yeah, that's something that really needs to be enforced. I mean, several of the restaurateurs that we spoke to are defying the order because they just can't survive without having outdoor dining now. And even if they do have takeout, they're setting up tables so that people can sit at the table
Right.
and actually eat. But the safety protocols have to be enforced. And I think everyone's getting a little lax at this point.
Yeah, and I think the outdoor dining should be allowed, but do it the right way within 6 foot and having open areas and things like that, to give these restaurateurs a break, if you would, and allow them to stay in business. So thank you all for joining us. As John had mentioned in the opening, glad to have you with us, and have a safe, happy, healthy new year. And we can only hope that 2021 is a lot better for all of us. So thanks for joining us. And while we're on break, feel free to go into our archives on Winsight Grocery Business, CSP, Restaurant Business, and SupermarketGuru.com, because I'm sure you might have missed an episode. And, we always have very intelligent, pithy comments for you. So make sure over the break you visit us as well. And to my cohorts here, Merry Christmas and Happy New Year. And John, I love your hat.